The most important thing as a patient in talking to your doctor about sex is that you have to have a doctor you feel comfortable with, period. You would bring up sex like you would bring up any other issue you were concerned about. I think it's important that you bring up the topic and start the conversation, because if you wait, it may not come up. Many doctors are capable of talking about sex depending on what the presenting concern is. So if it's a medical concern, you can talk to your physiatrist or your urologist. That can be very helpful in terms of describing function and medications. If you have emotional concerns, couples concerns, psychologists that are familiar with rehab medicine can certainly address those. If you have concerns about positioning and adaptive devices, your occupational therapist or physical therapist could help you with that.
In terms of speaking with your physician, I think you just have to be open. You have to ask them that question, and if they're not comfortable answering that, there's other physicians who are. Bone density is a big thing that needs to be addressed regardless. For a spinal cord injury, bone density tends to go down drastically within the first few years of injury. You shouldn't be putting yourself in positions that are going to cause you harm, such as a fracture or injury with your spasms. The other thing is spasticity. Sometimes you aren't able to achieve certain positions simply because your spasms are too severe. You want to ask, what are better positions for me, or this is what I'm trying to achieve. Can we make that work? It's just a matter of saying, I want to be able to engage in sex. Here's my issues. If lubrication's your issue, talk about different lubricants that you're able to use. Other things to ask them is range of motion, and it might be a matter of going back and seeing your therapist. You don't necessarily have to say to your therapist, I want to be able to get into doggy style. There's other ways to say it. I want to be able to get into downward dog position, or I want to be able to get up onto all fours is enough, because in the back of your mind you might know that you're going to get into that position to accomplish sexual intercourse, but it doesn't have to be, this is what I'm trying to achieve, if you feel awkward speaking to them about it. Patients are looking at websites before they come to a professional just because it's less of that awkward face-to-face encounter. But I always tell them that take everything you see on the internet with a grain of salt. It's not always right for you, it's not always right in general, and it could be really discouraging. Sex shouldn't be discouraging for you. It's going to be different, and you have to accept that it's going to be different, but there's ways to have enjoyable sex. It's okay to roam and do your own internet search. It's just a matter of being able to talk about it after you find this information and say, hey, is this for me?